Dr. Shelly, and this is HETV on YouTube from Shelly's Nursing Review. And we are here to help all the new grads coming out this beautiful spring in terms of how to study for the NGN-NCLEX without a review course. How do we get you that big, huge pass? What should you do? What should you not do? What have we learned since the test has been out, over a year? You might be surprised. So let's get started because we have a lot to cover and I think you'll get something out of it. Number one, let me say this loud and clear because it's the number one reason students fail the NGN-NCLEX. Do not go on a break or a vacation unless you plan on studying for the whole vacation. See, what psychology teaches us is that it only takes about 3 to 6 weeks to forget just about everything you ever learned in nursing school. I know it sounds crazy, but that's just how our brain works. So you need to stay focused. After all, you're not a nurse yet. You haven't even earned a vacation. I know it feels like you have, but in this country, just like with the bar exam, you can't practice nursing without passing this NCLEX exam. And so what you don't want to do is set yourself up for failure, go on this wonderful vacation, come back and kind of not really buckle down the way you're supposed to. And then you've lost a lot of what you retained for finals, which is your opportune time to build on it immediately following those final exams. The other thing is it's really shocking to me how many students don't know their state that they're trying to apply for the ATT in. So if you were to go on a break or vacation right out of school and you lived in a state like Florida, well, I don't know if you know, but Florida is one of a few states that your ATT expires in 3 months. So you get back from vacation, lollygag a little bit longer, kind of shuffle your feet before you really buckle down, and all of a sudden you have a test that you need to pass, or you just wasted $200+ that you used to pay the Board of Nursing in Pearson VUE. So at least do yourself a favor, at least find out if you are in one of those states like mine, Ohio, which gives you a whole year, or most states will give you 6 months. And let's think about that. Why did they give you 6 months? Why does the ATT not expire for a whole year in some states? Could it be that it takes a minute to really study for this test, just like the bar exam? Okay, I want you to think about that. All right, now let's move on because I think I made my point. This, again, is the number one reason why people fail the NGN-NCLEX because they took time off to take a break or go on a vacation and didn't work out so well. If you look at my inspiring testimonies, half of them took a break or vacation, came back, tried to get engaged into the process, and they failed. All right, number two. The number 2 way to study for the NGN-NCLEX exam without a review course is to anticipate 12 to 16 weeks to study. Now, here's the thing. We have a 12-week plan right in our playlist for Shelly's Nursing Review HETV on YouTube. If you were to go to the playlist of HETV, all capital letters, 4 capital letters, HETV. If you go there, you will see NGN-NCLEX self-study tips and guidance. And right there is the 12-week plan all cut up for you. And this is based on a new graduate, and it's based on a student who went to a halfway decent school. And this is going to work really, really well. I tell you which subjects to start with, how to cover them, how you go through your weeks, what are you doing exactly. So anticipate that. I think what is a little unnerving is students tend to be, no fault of their own, but they tend to be a little bit unrealistic about how long they got to study for this. It's a lot of material. It's a tremendous amount of material. And if you are like so many students who didn't go to a good school, or the school they went to, you didn't have great clinicals, and so many of the students in the last few years got screwed out of their clinicals just with COVID alone. If that's you, you need to take time. Now, I will say this. If you have failed before, especially 2 times or more, you're going to need 3 to 6 months to study. And I'm being very real with you. And so I think if I just put it out there and let you just digest that, you won't make the mistake of going before you're ready or not allowing that kind of time to study. Okay. The number 3 way to study for the NGN-NCLEX without a review course in 2024 is to try your best not to work more than 24 hours a week. That would not have worked for me. I was raising my child on my own. I had dropped out of high school pregnant. I had absolutely no help. And so I had to make it happen. So I do get that. I understand it completely, but then don't be unrealistic and try to do a 12-week review course or program, not review course, but a 12-week schedule studying for this NGN-NCLEX if that's your situation, because it's completely unrealistic. If you work 40, 50 hours a week, then allow yourself more time. And in that situation, you might want to rethink applying for the ATT in a state that only allows you 3 months to study if you work that many hours. I'm just trying to help you do what you got to do, because I'm over here on this side looking at my beautiful students, and when they follow these rules, they all pass, but the ones I talked to that I never met before, and they call me for a consultation, like that $35 consultation, most of them work way too much to even focus. All right. Number 4 way to not fail the NGN-NCLEX. I need you to remember, and look at it, I even put it in pink writing. I need you to remember to study the Oh My God packet or the pink packet, some kind of pink packet every single day. Now you might be saying, what the fuck is an Oh My God or pink packet? Don't worry, we do have them here. And certainly most of you even have them or have heard of them. The Oh My God packet is the best study guide in the world. All of the students will tell you that's how they pass their test. Many LPNs, this is all they needed to do. So that's the Oh My God packet. In the pink packets, we have our procedures or reduction of risk, which is the #1 area of failure. Also with basic care and comfort. Your Oh My God packet and your reduction of risk, both of those cover the basic care and comfort. Then we have our management of care. And if you're an LPN, this is called coordinated care. This is 20% of your test. Then we have infectious diseases, and certainly this is very critical because the test, this NGN-NCLEX has put more of these on the exam, and so you're likely to see quite a bit from this packet on your test. And then there's the almighty medications. Believe it or not, these next few packets all pretty much include medications. So there's the 2024 medication categories. There's the alphabetical order, pharmacology, and then there is the psych meds, because psych meds are the #1 meds on the test, and next are cardio meds. And then of course we have a packet that we throw in there with your 8 for 88 EKGs. Now, again, what am I saying? I'm saying one of those pink packets should be in your hot little hands when you wake up and right before you go to bed. Every single day you must study something pink. The Oh My God packet, you must know it so well that you're like me, you know the page numbers by heart. It is prioritization. It is delegation. It is your diets. It is basic care and comfort. It is your positioning. It absolutely is your ethical legal. It's so much just in the Oh My God packet, pharmacology, everything, that you are crazy not to study that. Now, if you just wanted to get the Oh My God packet, of course, it's $35. But moving on, because we gotta get you a license. Here we go. do NCLEX type questions every single day. You don't get a day off with this. My students know how serious I am. I know you're not in my class, and maybe you better be glad you're not, because when those students come through that door over there and they come around my desk and I check what they've done, if they haven't done at least, get this, at least 5 to 25 questions per day during that week that I haven't seen them, because we meet here on Tuesdays. If I look in your phone, and I can check your phone and tell what you've done. If I look in your cell phone and pull up your UWorld and I don't see a test for every single day, which is not enough, by the way, you should be doing way more than one test a day. But if I don't see at least that, you get charged $5 every time I can't find it. So let's just say it's the 1st is on a Tuesday and we left class on the 1st. When I see you're a little behind again on the 8th, I'm going back to look, is there a test for the 7th, the 6th, the 5th, the 4th, the 3rd, the 2nd, and the 1st. That's $35 if you miss the whole week. And you only get a couple chances to do that before I kick you out of my class because you're not very serious about learning anything. So you're not in my class. Aren't you happy? Yeah. But some people do need that kind of like, okay, mama bear type stuff. You're not in my class. So you've got to find a way to make yourself accountable for doing these questions every single day. Sometimes it's as simple as an alarm clock. You know you go to bed around 8, 9, 10, 11, or 12. Pick one. And you know that before you go to bed, you have your routine. You brush your teeth. You do whatever. You better set that alarm clock for when you go to bed to crank out 5 more questions. You're not done. If you're only doing one 5 to 25 question test a day, you're going to be a year trying to pass. That's not enough, but at least you did it. At least you did something. Okay. All right, so that's that. Now that's that side of the board. Let's go over to this side of the board. Again, we are trying to get you to pass your NGN-NCLEX without a review course, and it is possible. You just need a system, and I'm providing that system today. Here we go. Number 6, keep your practice quizzes 5 to 25 questions at a time. No, not for 24 hours. I said at a time. Here it is, but do more than one quiz a day. So if I use an example and say that tomorrow, because you heard this today, you're ready. You are on your ball. You bought the UWorld. You're ready to rock. You wake up to your phone. We all do. You did 5 questions, not Instagram, TikTok, or Facebook. Oh, no, boo. You got a test to pass. So you did 5 questions in one subject that you're trying to master. And then once you got started with your day, if you worked that day at lunchtime, you did 10 more on your lunch break. And then once you got going on, if you work a 12-hour shift, once you got off of work and you were exhausted, you did 5 before bed. See what I'm saying? Now let's play it all the way out. Let's say that you had the day off the very next day. Oh, you're doing all kinds of shit. You're just not doing questions, because if you just do questions, you'll never pass. You need content, and content are videos. So either you looked at the UWorld videos, you looked at my videos, you looked at Simple Nursing videos, you looked at Level Up RN videos, RN Registered Nurse videos. I'm not selfish. I know just from my own experience, there's some great videos out there. I did put my entire nursing school, which is about 500 videos in every subject, for free. No one else has done that. I put all near 500 on YouTube for free, and they're all organized under the playlist. If you don't go to the playlist, it gets really difficult to find the subject you need, and you need a system of subjects. So my point simply is, you can't just do questions on your day off. You must also fill your beautiful mind with content, and content is always tutorial videos structured like a lecture. Okay. Number 7 way of passing the NGN-NCLEX exam without a review course is to tackle one subject at a time. If you're in the Oh My God packet, then you will know that these subjects are on page 4, and these are the subjects. You have several of them, and the order to do them in is actually on page 23. So we have an order that we use to do these subjects in, and we absolutely tell you how to do that. And then you use page 4 like a checklist so that you don't miss anything that you're supposed to do. And you take these subjects one at a time, and you do the 5 to 25 questions all day, every day in that subject. And once you get the subject mastered, which for the RN is in the 80%, for the LPN is 75%. Once you master this subject, you're not done. No, those were just little tiny quizzes. Once you pop up and, oh my God, I got an 85% in psych, I can stop. Yes, you can. But here's number 8, the next way to pass the NGN-NCLEX without a review course. Once you have mastered this subject, do a final exam, 85 questions in that subject. So yeah, you did 5 to 25 NCLEX questions in psych. You got your 85%. You're not done. You have to try to answer every psych question you can, 85 of them, if that's what you have. And you have to try to do that with an 85% or an 80% if you're a new grad. The number 9th way to pass the NGN-NCLEX exam is to use only 3 resources. I am astounded when I talk to you for your little $35 consult and you tell me that you used everything. Oh, let me explain. You used Archer, you used UWorld, you used Simple Nursing videos, you used anybody else's videos, you used Remar, you used Climate, you used everybody and then some. Narrow it down, baby. Stay focused. Get you a system. Really, 3 resources are what I suggest you use and stick with. I don't care what those are, but suggestions include that your three resources must include content, which is videos, questions, which is geared towards getting you acclimated and comfortable answering these high vocabulary type questions so that they do not shock you on the test, so that you can get some case studies and get used to how to answer those. By the way, don't put too much focus in the case studies. You do real well on that. You don't do so well on basic stuff, okay? So don't go crazy with case studies. Then flashcards. Flashcards are nice, but you have to make them if you really want to learn. I wouldn't make flashcards out of everything. I would only make flashcards out of medications, like the ones in the packet I showed you, and infectious diseases like the one in the packet I showed you. And let me just show you with the infectious diseases. You, again, are making these flashcards for the medications, and you're making the flashcards for the infectious diseases. Okay, so these are really easy. You put the infectious disease on the front of the flashcard and the precaution and treatment on the back. The last way, number 10, the last way to pass the NGN-NCLEX exam is to get you a buddy. Things are a lot more fun, memorable, and easy to do when you have a buddy system. That buddy system might be your husband. That buddy system might be your 13-year-old. They may be helping you with those flashcards. I don't really care who the buddy is. You just kind of need one because you need to get out of your own head and listen to someone else. Now, it doesn't work so well if you got 4 or 5 buddies at a time. You're going to bullshit the whole time. And I know we had this one group in my class that met all the time, and those little shits did shots. Yeah, they did shots. I think they learned something, but it took a little longer because they were all high and maybe a little drunk. And so we'll just move on. But I'm so serious. It was fun. I don't have a problem with it, but you know, I don't know if they learned anything. So keep your little crowd small. Get you a buddy who is, you know, serious about this learning. And then don't forget, there's someone in charge, and it's not you. It's not me. It's God, right? So I don't know if that's Allah for you, God for someone else, Buddha, whoever it is. There is a higher power that is controlling things and can probably help you quite a bit be successful on this NCLEX exam. Now, let me say this last thing because this was geared towards the new grad, but of course, obviously, anybody who failed a test could learn from it. But if you did fail your test, I have a little special love letter down here. If you failed before, you must understand your candidate report. And of course, we help you do that through our consultation. And here you can always text, don't call, I'm not going to answer, don't email, I'm not going to answer, but you can always text 216-410-0936. Remember, I'm on Eastern Standard Time in Ohio. I know I forget, please try not to. If you want any of the packets, feel free to text me. We do have a special going on now. You're the first to hear it. You know how you get the 8 for 88 pink packets? One of the things I want you to not do when you take this test is I don't want you to forget health promotion and maintenance. What is that? Oh, I'm sorry, but that's maternity, growth and development, pediatrics. So I'm going to throw all 3 of these in with your 8 for 88, and it's going to be fun for 99. Let me know if you want to take advantage of this. Hope this helped. Deuces.